My name is Dr. Aaron Bates, your Ventura County Spine Authority, and today we're going to show you how you can prevent 88% of all hip replacement surgeries. We're going to look at a series of x-rays where you can actually see individuals that are developing degenerative hip and joint disease, which can actually be prevented. You're going to see how 88% of these people will actually develop the degenerative joint disease on the side of the long leg, which will make more sense when we look at the x-ray. And how chiropractic is the only profession that can actually resolve the alignment problems that will lead to this unfortunately common syndrome. Okay, this is a perfect example of a patient who came into our office with low back pain, as well as a knee problem, as well as a IT band syndrome, as well as hip pain. When we look at the x-ray, you can see his innominants out here. This is your pelvis, and these are actually your hip joints here. And what you're going to see is his left innominant is actually rotating forward and up, which is creating a curvature of his back. And the reason why that's very important is you're going to see his left hip is actually higher than his right one. And what we know is 88% of all people who develop degenerative hip problems always happen on the hip that is actually higher. So here you're going to see degenerative changes on the superior portion of the hip joint and the medial portion, whereas if you look on the right side, a beautiful, nice, healthy joint. Some doctors might say, well, you know, John, that's not really his name, just so that's how I tell this story. Well, John, you're getting old. Well, if that were true, why is this hip getting old, but this one's not? It's due to the abnormal stress in that joint. This is an example of a patient who's had a hip problem for a very long time. Not sure why it took him so long to finally make it to our office, but you can see that on his x-ray it's blurrier because he's actually got a lot more sclerosis, which means breakdown in the joints throughout his entire spine. But you're going to see the areas that he's aging the most. If you look at his left hip, he actually doesn't have any deterioration, maybe a little bit at the superior portion. But you come over here to his right hip, remember that's the higher right hip, 88% of all hip degeneration will happen on the higher hip. And he has full-blown bone spurring, almost fusion. And these are the type of problems that a surgeon will want to jump all over right away and do surgery. And it's been taking us actually a couple months of treatment, but this patient's doing really well. And here's an example of a patient who you can see kind of the before and afters of what we expect. Here's a patient who had a 12-degree curvature of his back due to a full centimeter drop in his right innominate. You can see his left one is much higher, creating a much higher left hip here. So as we know, he's going to develop degenerative hip problems on this side. And here he is after his treatment. You're going to see his hip level is almost perfect. His innominate level is almost perfect. Still has a bit of curvature in his back, but that looks pretty darn good. I'm also going to show you on this video how, oh yeah, that's right, maybe